to tune in. This is being streamlined live as well on WNZF, so we're grateful for our partnerships in the community that allows us to host these weekly town hall meetings in an effort to keep you continually updated as a community with our stakeholders and partners in the community. Thank you again for your submittal of all your questions. We really do value our residents staying involved and engaged. It's a critical component for the success of us navigating through these very, very uncharted territories that we've been dealing with for the last several months. So I'm always pleased to have our team here at City Hall, and then we have some of our, as well, some of our partners that are calling in. So I'm going to move forward and introduce those that are here today and as well on the call. You'll hear some updates by each of the members of our team, and then we'll start going over some topics as well, and then followed by some questions that have been submitted from our community. So first I'd like to introduce Gretchen Smith, who is always welcome here. I'm so grateful. And she is with our Health Department of Flagler County. She's been in charge of not just communications, you've been in charge of a lot in the last few months. Really just not only making sure the public is aware of how the health department is responding to COVID-19, but really, again, the contact tracing and those sorts of things and making phone calls. And so your job responsibilities have been stretched quite a bit. But we're grateful you're here today to give an update for the health department. We also have our city manager, Matt Morton, city manager of Palm Coast. Thank you always for co-hosting here. Yeah. And on the call, we have from Advent Health, we have Dr. Mucciello. Welcome.
Thank you.
Yes. Thank you so much for being here. I know you're going to provide some valuable updates from Advent, and we're really appreciative that you're going to be able to respond to some of our residents' inquiries and as well. So our partnership with Advent is very strong. It's one that we really value, so thank you so much. We also have Dr. Bickle. I always refer to him as our resident expert on all things COVID. He has been at the forefront of really navigating this response from the healthcare medical perspective, and has really been a true hero in helping us keep our numbers where they are and trying to do everything we can as a community. So welcome, Dr. Bickle.
Thank you. Happy to be here.
Thank you. And we're always happy to have Jonathan Lord. I always question if Jonathan ever sleeps, and I'm not sure if he does or not, but our county emergency management department is under the auspices of Jonathan Lord and his team, who have just tremendously navigated through COVID in a way that's also been coupled by wildfires and droughts and hurricanes, and so we really want to just give a big shout out to Jonathan and your team, say thank you so much, and I know you're going to be providing us sort of the first responder management update as well, so welcome, Jonathan.
Thank you. It's my pleasure to be here, and I don't believe that I sleep very much. You are correct.
Yeah, I can't imagine you do. I know. So first we're going to start with the health department update. So Gretchen, take it away.
Thank you, Mayor Holland. All right, so where are we in Flagler County right now? Total positive cases in Flagler this morning was 1,101. This compares to 473 positive cases 4 weeks ago. Deaths related to COVID in Flagler, total 13. The positivity rate for new cases over the last 14 days is 6.5%. This compares to 1% a few weeks ago. Hospitalizations, which we're going to talk with Dr. Mucciello a little bit later, related to the virus is 19, which is high compared to previous weeks. But this means that our workload for our public health nurses and our disease investigators has increased significantly from 100 positive cases and tracing calls a day to sometimes up to 400 calls a day. So we're busy. There is some good news though. If you look at the data that comes out from the Florida Department of Health in Tallahassee, emergency room visits for COVID-19 began a downward trend the week of July 12th. I think a couple weeks ago we heard Wally Aquino say that he felt that they had reached a plateau. And we are seeing a downward trend in both those COVID-like symptoms and also those flu-like symptoms. So that's good news. The RT value, which represents the reproduction rate of the virus from infection, from an infectious person to another, is less than 1, and now it's 0.97. The lower, the better, in our opinion, for decreasing transmission. A new report came out a couple weeks ago, is the number of children who are testing positive for COVID by county. For Flagler, 92 people who are age 18 years or younger have tested positive. This reflects a positivity rate of 12.4%, which is less than the state average of 15%. And just as an aside, we hear from the people who are doing our contact tracing that it's really not unusual for an entire family with small children to be infected by the virus. Let's see. Our public health strategy is focusing on testing, tracing, isolating, and monitoring for hotspots, including nursing homes and other congregate care facilities. We're fortunate not to have a major outbreak in a long-term care facilities. We do have one outbreak in a small group home and another in a small assisted living facility, but all the folks involved are in quarantine. Their close contacts have been identified, tested, and infection control nurse specialists are providing the owner with proper guidance. Community testing continues. 14% of our residents have been tested for COVID. We're responsible now for 95% of the community testing activity. Options available include, we're testing Monday through Saturday. The largest testing site is indoors at the Cattlemen's Hall at the Flagler County Fairgrounds. That's 4 days a week, Monday through Thursday, from 9 a.m. to noon. This is the only place that requires an appointment, so please call 386-313-4200 to arrange your time. The remaining sites do not require an appointment, and each can accommodate up to 60 people per session. These are drive-through sites, including Santa Maria del Mar on Mondays from 4 to 6, First United Methodist Church of Bunnell on Wednesdays from 4:30 to 6, the Flagler Beach Pharmacy on Thursdays from 9 to 10:30, Mother Ann Seton Catholic Church each Friday between 9:30 and 11, and Church on the Rock in Bunnell Saturdays from 9 to 11. We appreciate all their support. Each site is operational on a separate day with various testing times, attracting as many residents as possible. And a word about test results. We're really pleased about how the numbers have changed and how we're actually getting results back in a shorter period of time. We contracted with a lab out of New Jersey, and we're actually starting to see test results come back in more like 5 days. So that's good news. Case investigation, contact tracing, and making those hundreds of calls every day related to monitoring remain our priorities at the Department of Health. Through CARES Act funding, we have been able to hire, we have the funding to hire up to 40 additional staff to keep up with the core disease investigation tasks. So far, we've got 27 people on board, and they've been trained. They're doing everything from doing the tests themselves to contact tracing to working in a call center to supporting our efforts as much as possible. And thanks to Flagler County for helping us find space. We have our testing team in their new digs at 120 Airport Road on the second floor. So we're excited about that. And finally, we have masks to distribute. We've given out about 187,000 to date, and I just put in an order last week to get more. We applaud both the City of Palm Coast and Flagler County for their mask wearing campaigns. We've also partnered with Palm Coast Fire Department and the Flagler Beach Police. They're helping us distribute masks, and if you and your organization need face coverings, not the one that I'm wearing, but they're soft, white, cotton, give me a call, and I'm happy to get some to you. My cell number is 386-276-1168. That's all I've got.
Thank you so much for that update. And yeah, we definitely want to recognize, again, additional members that have put forth a lot of effort for mask campaigns. I know our communications team has put together a great video. They're asking residents to also take some selfies with their favorite masks and hashtag it at our social media mask campaign for Palm Coast. And that is on Palm Coast Gov. I know that the tourism office is doing a mask campaign as well with the businesses, pledge for the mask as well, and I know the businesses have really stepped up, Amy Lukasik has said, in an extraordinary way to ensure that they are setting the tone and the standard in which we're trying to really, again, mitigate the spread. So thank you for that update. I would encourage everyone to, again, participate in our mask campaign and sign up for it. And, it's a great way to get to know your neighbors and get to see some crazy masks and some, creative ways to wear a mask. So thank you so much. And so we will ask for an Advent health update now. Dr. Mucciello, are you ready to give your update?
Of course. I didn't have specific numbers because as was mentioned, some of the data lags behind. So what I can tell you from the emergency department, and I am delighted that the patients are coming in now for the emergency conditions. And this is the thing that I cannot stress enough. Although it is the hospital, although we do have COVID patients, it's safe. And it is important if you are having symptoms of a heart attack or symptoms of a stroke or sustain an injury that requires immediate attention, like a laceration or a fracture, that you come in quickly. And I have to applaud you and the radio stations and our local Department of Health for making such a concerted and strong effort to get this out to the community. Because when COVID first came out, we had a lot of cases where patients didn't come in for a stroke, heart attack, and other injuries, and the outcomes were less than positive. We had, with the uptick in cases that I now, it looks like have plateaued and may be going down a bit based on the data, we've seen people starting to come in again because they understand that it's safe to come to the hospital. So I can't thank you enough for coordinating that effort and getting the information out.
Well, and thank you to all of the healthcare workers over at Advent. I know you have a huge responsibility over in the emergency room. However, there are so many workers over at Advent that have now gone through months and months of tremendous sacrifice to ensure that our community is well taken care of. So please send our greatest thanks to all those in the healthcare field over at your hospital. We are thinking of them often. We are literally trying to do everything we can to make sure they know we're here with them.
I most certainly shall, and I appreciate the goodwill and will pass it on. Thank
you so much. Jonathan Lord, can you provide an update county-wide as far as the COVID response? Anything you want to add as far as, I know we're very lucky, I guess if you could say that, with the hurricane that passed us, but I know a lot of planning went into that, and any thoughts on some maybe upcoming areas that residents need to be prepared for?
Yeah, so as Gretchen mentioned the numbers, and I want to first start off by saying that folks I really do not want our residents getting focused on the numbers. Because if you look at the numbers, you can spin any set of numbers any way you want. If you look at one set of statistics, we have the lowest rate per 100,000 in the state of Florida of cases but that rate's going to go up. It's great that we're the lowest, but it doesn't mean it's not spreading. So I don't want folks, getting super excited about that. We'll have days where we have a bunch more cases reported and have a high percentage of cases. On the opposite end, it doesn't mean we're doing horrible in Flagler County either. I think the important thing for our residents to truly note is COVID is out there. COVID continues to spread. It is not going anywhere until we can get a thorough vaccination program in our country and in our community. And that folks just take the simple steps of social distancing. I mean, to stand 6 feet away from somebody is so easy. To put a face mask on when near others is just so easy. So I just ask people not to focus on the numbers. We share the numbers because residents want to see that, and the data is there. There's no point in hiding it. But that doesn't matter if we were the lowest rate in the state of Florida or the highest rate in the state of Florida. It has been proven now many times over, the simple activities can stop you from getting sick and can stop you from potentially spreading it to somebody else. So people just social distancing, mask wearing. That being said, you are right. We had Isaias, I'm sure I somewhat butchered that again, that passed by a weekend or so ago, a couple weekends ago, and we were lucky. It was aiming right at us for a while there, and a day or so before it came to us, it weakened significantly, and then it stayed off the coast even though we remained in the cone. I would not say we were lucky. It was just what Mother Nature did. We were in the cone. It could have turned. Anytime we're in that cone, it can turn and hit us anyway. Just because the Hurricane Center has a little, and the weather reporters on the TV show a thin line inside of that cone, that's not necessarily where the storm is going to go. That storm can travel, the eye of the storm can travel anywhere within that cone. The Weather Service realizes that this is not a 100% guaranteed science. That's why it's a cone. And it's not about the center of the cone. It's about anywhere in the cone. I think all of our partners, the county, Palm Coast, the sheriff's office, all of the fire departments, our other municipalities, Flagler Beach, Beverly Beach, Marineland, Bunnell, all of the rest of the partners, they were all part of making sure we were ready for this. We even called out all the residents in Zone A and gave them a heads up to be prepared to evacuate. And even a small selection of residents in Zone B are immediately along the intercoastal, and just said, be prepared. Because that's what we thought. If the storm was to turn with little notice, we knew what areas we may have to evacuate, worst case scenario. So we prepared for that. We had a shelter ready with our shelter partners, the school district, amazing partners, the health department, our volunteers that are all part of the sheltering team, the city of Palm Coast. I think you guys want to offer up some firefighters to help us out in the shelters if we needed them, or paramedics. So it was just a great team, was ready on standby. We kept them on standby until the storm was up near the Georgia line, basically, and we knew it wasn't an issue at all. So just to reassure our community, we were ready for that. Sheltering in COVID-19 times is special. It's different than our normal sheltering process. We don't want you to stay behind if your area is at risk for storm surge. COVID may kill you, and the odds are low, but it's still a big risk for our community. But storm surge, if the storm did turn, storm surge, that wall of water that comes in off the water, that is guaranteed to kill you. In hurricanes, it's not the wind that kills you, at least not in our country. It is that surge that potential surge of water. So it's kind of like, which threat do you balance out? And to me, we have to err on the side of caution with the guaranteed threat if it was to turn. So we were ready to open the shelters. We knew what areas we would have had to evacuate. We were lucky the storm did not turn, but we were prepared anyway. We had protections in place in the shelters. Again, nothing is guaranteed in life, but we were going to do temperature screenings, medical questionnaires on a regular basis in the shelters, as well as upon entrance. It was going to be 100% mask wearing required. We had masks if residents couldn't bring their own masks or their masks got dirty. We had backup masks ready. Our staff and volunteers, we had medical grade masks available for them. If someone did show up that was positive, they knew they were positive or seemed like they may have COVID-19, we had a plan in place to move them to a separate area of the shelter so they would not infect others. But again, nothing would have been guaranteed because someone, as Gretchen and Bob have shared in the past, someone can, and any of us could have COVID-19 and not know it at this point in time. We could be positive, our body just deals with it and we don't even realize it. So we were prepared for that to happen. Even simple things like lining up for food in the cafeteria wasn't going to happen. We were going to make sure packaged meals were brought out if we were have to open the shelter. So we were very prepared for those that would have had to evacuate. Our messaging was a little unique this time too to the public to help stress that if you were not in those evacuation zones, please don't evacuate. A lot of times we have extra evacuees that don't need to evacuate just because they want to be more comfortable in a school shelter. But we pushed our message to say, Only those that may be in these areas, please be prepared to evacuate. And then we also encourage our residents. Hurricane season, we're not even at the peak yet. The peak, that middle point of hurricanes for our area, for Florida particularly, is September 10th. So we are approaching that peak. So this is a record-setting hurricane season already. We've never had this many named hurricanes in the Atlantic Hurricane Basin ever before. We're lucky that none of them have impacted us directly. A lot of that had to do with Saharan dust that was causing the ones that would have come towards us to be minimalized a little bit, but that dust layer that does have a huge impact on the hurricanes is slowly but steadily vanishing, and we're approaching that peak. Most of our storms happen end of August and September and even into early October. So I really want our residents to be prepared. I really want our residents to take the time now. Again, COVID-19 is going to be here for the rest of this hurricane season. I can guarantee you that. I'll guarantee and stake my job on it that COVID-19 will still be a concern for us for the entirety of hurricane season. Again, if you have nowhere else to go, we will have shelters available with our partners. But I really want folks that have the means and ability, take the time now to think about if your neighborhood, if your zone is ordered to evacuate, have a backup plan in place now, whether it's going to friends or family that are outside of that evacuation zone. And it doesn't have to be 2 states away. I'd rather it not be 2 states away. It just needs to be outside of the evacuation zones. Friends or family that you guys can separate. And again, if you don't normally see those folks, that you wear a mask in their houses if you're doing that. Or hotel rooms. We're lucky that we have Orlando. That is, the outskirts are less than an hour away. And these days with the lower tourist traffic, because I was out that way about a week or so ago, I-4 is amazingly easy to travel on, even during rush hour right now. Knock on wood, I know that won't last. There's tons of hotel rooms available. So if you have the means, think about a plan of what hotels and what order you would call and book a room. And don't head towards Orlando without a room. Book a room, then you and your family can stay in that room and socially distance if you have the means. But if you don't have the means, please do not make the wrong decision. Stay behind in the house if your house is in an area told to evacuate. Please, come to a shelter. But if you have the means, we recommend you have another plan in place now so you're not scrambling. Make those arrangements and be ready in case an evacuation is ordered in hurricane season. Hey, I'm hoping we don't have to evacuate anybody, just like we did for Isaias. We didn't actually have to call for the evacuation. Got my fingers crossed, but I'm a realist. We have to be prepared. I want our residents to be prepared. Same thing with disaster supply kits. I pushed it months ago when we had the sales tax holiday to make sure you have the kit. For those of you that were not able to build a kit at that point in time, but now can, please visit our local stores. It's all about our local economy. All of our businesses are hurting too. Please visit our local stores and build those kits. It can be the chain stores that still employs. Those chains, while it might be national companies, employ local residents. So please keep our businesses functioning and build your disaster supply kit now. Don't wait until the county or the city tells you a storm is 2 days out. Don't forget to go buy your kit. Take the time now. Buy 1 or 2 things every shopping trip to add some more supplies to your kit. And please continue to be prepared for hurricane season.
Thank you so much. Great update. Very important that our residents heed all of these warnings, frankly, from our emergency management team. They are the experts and trained in this area. We rely on them for their expertise. And any way we can help communicate that to our residents. So please share this information with your neighbors as well. Again, anyone can tune into our town hall meetings at any time, but it's really important information and just can't emphasize it enough. So I'm going to turn to our city manager, Matt Morton, for a city update, really just about, we've talked a little bit about reopening strategies, those sorts of things, but City Hall, still remains closed to the public. And, we've got some sporting events coming up, those sorts of things, if you can address.
Thank you. So yes, kind of with the theme, we're still, as we talked about last week and we've heard today, we're still planning for the long haul. COVID's going to be here for a while. I think we're doing, better. We're learning lessons every day, every week, and we're putting those lessons into practice. We do continue to evaluate and reevaluate, on a weekly basis, sporting events or tournaments or, those types of things as they might come forward. So far with any of our open space uses, whether it's our Indian Trail Sports Complex or limited use of, other parks for play, for our hometown recreational leagues, such as our, Palm Coast Little League, who again was one of the first ones out of the gate with a phenomenal management plan and distancing strategy and a system where they're, monitoring and making sure they're abiding by their rules to keep people safe. And I think they've had great success with that and a great partnership. We've seen other local sports organizations come online with those similar strategies. And similarly, we're doing the same thing with any tournaments that may or may not be held in the fall here in Palm Coast. I think, part of it is, again, we continue to monitor. As we talked last week, we have flu season coming and what that brings for that, commonality in symptoms and what that might do to people's anxieties or perception as when it comes to COVID. We know that's going to add stress to first responders. We know that's going to add stress to hospitals. So we continue to monitor that situation, but we also continue to ask those people who prospectively want to come and hold their events to abide by and submit those plans for review. So we have several plans under review now. We've continued to evaluate. We have a walkthrough actually coming this week where we're going to go walk the facilities again. We have a tour planned of City Hall to kind of walk through if we in fact wind up, opening in the near term, which at some point, obviously, we will be back open to the public. How does that flow? What does that look like? How do we continue to provide excellent service? How do we continue to respect our residents and keep them safe? How do we keep our employees safe? As of today, the city itself has a little more than half a dozen employees out who are positive with COVID-19. So we continue to take the approach that we have to be here healthy to serve our residents. We have asked our staff to understand that. We made a choice for public service, and one of our primary responsibilities is to stay healthy, follow the best guidance and practices we have so we can be available here healthy to respond to our residents' concerns and needs. They look to us for that. That's what they expect. And so as we talk about reopening strategies, trying to find those last few pieces, Captain Asconi with our fire department continues to remind us all that through Palm Coast Connect and through that virtual town hall, it's enabled. The 13,000 or so calls a month we're getting, over 40% of those now are being handled digitally through web interface, through PCC. We're having extraordinary success delivering virtual services and engaging with our residents. Those few areas where we still have some services that we need to get back online, one of them is the quasi-judicial hearings, or the land use hearings essentially is what those might be. Those have been stopped since March because we want to be inclusive and we wanted to create a process. So we're working on that component right now. If you listened to our council meeting last night, of how do we make sure we get maximum engagement, again, provide opportunity both remotely and physically for our community to stay informed, stay engaged, and be part of their city. So we're taking that same methodology right now and continually reviewing it against what we do day to day and week to week. Right now, Chief Forte would say, and he said it this morning on a call, it's the best analogy we have. It might be a bad analogy, but we're really at a cruising altitude. We're sort of, in flight. And I want to be sensitive to what Jonathan said. We don't want that to be translated to, let your guard down, or don't take the recommendations seriously, or don't continue to be vigilant, whether it's COVID or hurricanes. But we're in that phase where the new information that we're getting is very slow. What we're now dealing with is monitoring the hospital admissions, the admissions for COVID or flu-like symptoms, the ICU bed availability. How does that translate to the percentage of our workforce who's ready and available? How does that translate to, countywide and regionally, the availability of resources that we have, again, to continue to be ready to respond. So it's an active process. To continue to plan right now tentatively, and I know we've tentatively planned twice before. We expect to be open on a limited basis back to the public the first week of September. There will be a pre-screening check-in process. We're going to hopefully have some docents here, so when you come up, we'll help you get screened. We'll figure out what we can help you with and where you need to go. Make sure you get, where you're going and can get served efficiently and quickly. So we're designing those plans with that best information, and again, more importantly, trying to be focused on the services we provide and on our residents.
Thank you.
Thank you.
Always ever evolving. That is the theme. And so speaking of themes, one of the topics today that, again, our resident expert brought forward that is really important, and I know is a topic that's often discussed, and some of the input we've received from our residents. So Dr. Bickle, can you really talk about today's topic, which would be around rapid testing and its future role in containment strategies?
Sure, be happy to. First caveat here is that this is not currently available. The technology exists. This testing strategy or technology is close to being ready. Hasn't been approved, and so this is kind of a promise. I think it's going to happen. There's kind of a groundswell of interest in this from top-level virologists and laboratory people. So I don't want to promise something we can't deliver, but I think it is going to come, and it could be a real game changer. So there are kind of three tests. I'm not going to talk about serology because that's a whole different ball of wax. But in terms of testing for the virus itself, there's kind of three tests. There's the laboratory high sensitivity kind of gold standard test. That's this RT-PCR test. Needs to be sent to a central lab for the most part, and that's where we get the bottlenecks. It's hard to do on a mass scale. That's what we've been struggling with for months to get the testing geared up. You have to go to a site to do it. And then there's second step is tests that are actually kind of close to that, which is this rapid test that uses a point of care, usually a little machine. Advent has them. Still limited access because you have to go to a place that'll do them. And their results are actually fairly close, but not quite as sensitive as the gold standard RT-PCR tests that we're used to. And then at the other end of the spectrum is a testing technology that has been developed and is pretty close to being finalized, that many virologists and laboratory professionals are getting very excited about. And it's basically what you think of as like a home care test for pregnancy. Like a paper strip impregnated with antibody, you put a swab on it or put a swab into some solution or spit on it or various ways of preparing the sample and have it sit on the strip for 5, 10, 15 minutes, and it's going to turn color if it's positive. Not as sensitive as these other tests, but it turns out that for some kind of complicated reasons that relate to when in the course of your illness, your viral loads of COVID are the highest, which is when you're also most contagious, these tests actually may become extremely useful for surveillance or mass scale testing of the populace. And the reason it's so important is that with our current technology, we're probably missing 80 or 90% of the contagious period of the population with COVID. When you take the number of how much of the time people who have it are asymptomatic before they even know they have it, and then you take in the fact there's a delay, but they get symptomatic and then get tested the next day or 2 days later. And even if you tell them to quarantine, they're not maybe convinced because they haven't been tested. And then you take the fact that a lot of these people don't even come in for testing. We may be picking up 5 or 10% of the period of time of people in the community being contagious, which makes contact tracing it's like you're doing it with 2 hands tied behind your back. The alternative would be if we had this, freely available. We're talking like tests that might cost $1 or $2, or that could be funded by the government and massively available, done in schools several times a week. We might be able to pick up as much as 50 to 90% of the time that people are contagious, between the number of extra people we're picking up and the fact that we're picking them up very early in the course of their illness before they've had this long period of asymptomatic illness where they don't even know they have it. So it's not available yet. People are lobbying the FDA. It's in this regulatory sort of swampland where they're trying to look at it as a diagnostic test. Is it a surveillance test? We're kind of billing it as a public health tool or part of a public health strategy that actually, I'm not exaggerating, has the potential to impact this illness on the level of a vaccine. And so there's a lot of we're lobbying for it. Lots of people around the country are. Maybe we can share some material through the Palm Coast Connect about it to get some lobbying efforts. I've been told, but can't confirm, that it would be possible for states and their governors to actually approve such a testing technology, that it wouldn't have to be FDA. I haven't confirmed that for sure. I heard it from a pretty reputable source, but I haven't fully vetted that. It's very exciting. It's actually what Bob Snyder and I are spending a fair amount of time on these days, trying to see what we can do on our level to push this along. So I don't want to make a hollow promise here, but I think this is going to happen. I think it'll come sooner than a vaccine, and it really could be a game changer.
And it truly is about, the data, right? So, I mean, the point of this whole exercise that we've been going through for months or using the best practices we have available to us to make the best decisions possible to keep our community safe. One of the areas that we've recently embarked on as a city is testing our wastewater. This is a very exciting opportunity for our community, but it's in partnership with our health department. Dr. Bickle was the first individual that brought this to our attention, this opportunity for our community to really have more of an evaluative tool, more preemptive, rather, taking the proactive approach. And so what we've been able to do internally with our team at City Hall is put the actual wastewater testing into a map using the data that's provided to us by the health department in coordination with our utility department, and we've been able to create overlays. So the hot spots, our residents will now be able to see on a map that is a public document that is regularly updated as we get current information. That's valuable for our residents to understand. It's also valuable for the health department to have, frankly. With schools getting ready to reopen, I know we'll talk a little bit about the schools in a bit. We've been able to create an overlay where the schools are in reference to where the zones are, where the testing is occurring, and the data that the health department is taking and providing to us with the positive cases and those that have been tested. So I know, Matt, if you want to touch on that, where we are in that process. And Dr. Bickle and Dr. Mucciello, the physicians, I think it would be important to just have that conversation now about why the data matters, right? And why it matters to our community. To Jonathan's point, we could talk about relativity to other communities and how that balances out, but what we're doing for our community is important for our residents to understand. So Matt, do you want to first take that? And then again, Dr. Bickle, if you want to pick up a little bit on it, or Dr. Mucciello, just around that testing conversation would be important.
Thank you. So yeah, we've been talking about this overlay testing, and we gave the presentation, and thank you, Dr. Bickle and the health department for helping us get that data together for that initial presentation to the council and the community on the value. And we spoke very high level of, the traditional testing is one testing, one individual, one result. Whereas when we've identified these collection points with one test, you sample a bigger population discreetly, both in terms of data collection and in terms of, not unique identifiers, but rather an area. So with that, we established 6 terminal testing areas that are logical collections that we can backtrack and say, okay, this is a geographic boundary we can establish, and at the end of that outflow of wastewater, we can test for copies of the SARS COVID-19 virus. So it took a while, obviously, to get through that process, to get the company on board, to install the sampling equipment, but I will say that we're 4 weeks in, which is 2 sets of data, so now we have something we can map. To your point, Mayor, we currently have a base map with the ALFs identified, the assisted living facilities and long-term care facilities. We also have the school district boundaries, and now what we're trying to do is show integers or a relationship of two values, and we're sharing this data as we get it. It's very fresh to the health department. One is using the zip code data to show where cases are in relation, and we're going to show those on the map as little pins so you can see the numbers and understand the number of cases. Now, one thing we're still working on, and I'll be asking Dr. Bickle to help us, not today on this call, but in the background, is, the first report showed we had 201,000 copies of the virus, and for most of us, we don't know what that means, in the first sample test of wastewater. So trying to establish what that looks like in a relationship. Is that low? Is that high? Is that medium? But what we're doing is going to show the wastewater mapping data as a color heat map index. So you'll see the index of the wastewater testing, a pin with the specific known zip code case data, so we can start to infer those relationships and see what our health department data is telling us, what our general city surveillance is telling us. Again, to be able to make better decisions for our community, to hopefully get an edge, as it was put, any edge we can get on the data, and then see those two in context with where our assisted living facilities are, and for the public's information, where your population is being drawn, let's say, for what school you're going to, whether it's one of the specific middle schools or high schools. Those boundaries are well defined, and we can see those relationships and overlays to know, is that zone hotter than the rest of the city, or what does that mean for folks? So I have the first drafts of those, and we will show a nice version at the next town hall next week. We will guarantee to do that. And start getting it posted to the website, because I think it's information that's both useful once we can quantify it that way and explain what 201,000 copies of the virus means in the wastewater test, to make it useful to our local health partners, again, Dr. Bickle and the health department, and also make it available to the community at large to view and understand what's happening. And so,
But Dr. Bickle, why is that important?
Well, I see three potential uses for this, and it's basically in the area of being proactive. One is it will be another very objective trend metric that will enable us to look at the trend of this versus how the cases that are identified. Because if there's a lot of people out there who aren't getting tested, we may see a lot of virus in an area and not have cases. Well, that just shows us we've got to find those cases. So it's a good trend instrument. And then in terms of identifying particular areas of activity, one is if they coincide with the heat maps coincide with a school or an institution or an ALF, then we could go with there and do aggressive testing there. We could also do community testing on an increased basis if we find an area like that. So the general sort of term used to this is called, it's kind of a slang term, it's called guerrilla epidemiology. If you think of international healthcare workers and they're trying to go into some country with an epidemic that's just started, they are groping for any kind of tool that will give them an edge or a way to target some preventive or treatment activities that will break the spread of things. So this is a way of kind of getting some special data through a different channel that we couldn't get otherwise. And because cases are so dependent on people coming for testing, that's the Achilles heel here, that this is a way of finding activity in an area that's we hadn't found before. It's very useful for trend. We're going to have to correlate it with rates of cases that we've seen and see what those numbers mean. But there's also data from counties, municipalities around the country that we can look at to see how their viral loads compared to their case counts. So it'll just kind of give us an edge, and we need edges here.
Yeah, I completely agree. Anything at our disposal, we're certainly trying to take advantage of, and again, utilizing the data to make the best decisions possible. I'm going to move into a couple public health questions, and Dr. Mucciello, I know you're very familiar with some of the aspects of some of the questions, so I'm going to ask that you and Dr. Bickle both respond. First, Dr. Mucciello, if you would. So these are two long questions, but I'm going to read them in its entirety, and I would just ask you to respond however you feel you can adequately respond to our residents, but these came directly from the residents within our community. As reflected in social media, both locally and nationally, there remain pervasive questionable beliefs and misconceptions about COVID crisis, including the efficacy of mask wearing, available treatments and cures, that children are immune to the virus, inflated case reporting. I've always been skeptical about the science behind 6-foot distancing rule, how airflow or breeze affect transmission. How about aerosol transmission lingering airborne for a reported lengthy period of time? Is it possible we've been wrong relying upon the 6 feet rule?
Sure, I'll be happy to touch on some of these and appreciate the opportunity. The mask wearing efficacy has been proven with numerous studies performed outside of the medical community. And sometimes that level of sophistication by, say, physics organizations has great validity, much more so than we as doctors could develop. I've seen a number of studies now that show that even cotton masks that are made at home, as long as they're appropriately layered, are better than some of the commercially available masks. So the masks do work, and just off the top of my head as an example, there was a test where they showed that without any sort of mask, exposure could go as far with, not to be graphic, but with a forceful sneeze as about 8 feet. And with the mask on, the protection was conferred to about 1.2 feet. So that's significant reduction.
Yes.
Treatments and cures are still preliminary. It's a viral infection, not a bacterial one. So the use of azithromycin, which is an antibiotic typically used for bacterial infections, hydroxychloroquine, and some of the antiviral medications that we hear of may not give a specific cure, but what they do is modulate the body's ability to fight the infection. And that goes into the children being immune to the virus. I don't know if that would be an accurate description. I would say that they're less vulnerable to it, but they do get it. And some children do get sick from it. The important thing to understand here is that, as Dr. Bickle mentioned earlier, we have to try to get a good model and a good grasp on asymptomatic carriers. I read a study that it's a relatively small study, but that the viral load of some asymptomatic carriers is as high as people who are exhibiting active symptoms. And that's why we can have a problem with what's called a super spreader. And those are the people you hear about that go to a party or go to a bar, no one's practicing mitigation strategies, and then a number of people get sick. We've all heard about that in the media. Inflated case reporting. That is something I think that was more of a problem before we could accurately test. And that was primarily, I read a lot of information on the American College of Emergency Physicians website about how people were reporting on admission paperwork and on death certificates suspected COVID illness or COVID-like illness. And I don't think that's inflated. I think that was reasonable to do because they didn't have a test. So they were doing the best that they could. I can assure you that the numbers that we at Advent Health produce and generate through our testing and reporting are accurate because of the type of test we're running and the surveillance that the data is kept under by our epidemiologists. The 6-foot distancing rule, I'm just running down my notes. I'm sorry, I'm trying to cover everything.
No, that's great.
I think that is reasonable. How does airflow affect transmission? Always a problem thinking about suspended particles, and that is something that we have to just do our best. Nothing's 100%, and I have to explain to patients on a daily basis that when dealing with anything biologic, especially your body, there are no guarantees. So we have to do our best. We have to look at what is probable and not what is possible. That'll help us maintain some sanity and get through this, and we will get through this. But that's why it's important when you say go into a store or come into the hospital, put your mask on correctly and wear it from the minute you come in till the minute you leave. I have people say, well, I have to take it off to cough. And I said, no, that's why you have the mask on. Cough into the mask and we'll give you a new mask because we're trying to decrease that spread. Also, one of the biggest pieces of advice I can give people is that if they want routine testing, please go to the centers that you have all outlined earlier in this communication, and reserve the hospital resources for people who are sick and actively showing symptoms. And out of that group, we have the Vivify system now that we employ for, I think it's age 14 and above. I have to double check though. And what that does is allow us to take care of our patients at home, where they're comfortable, where they feel safe, and where they can control their environment. And that has been a tremendous help for us. And out of those patients we send home on whom routine testing is performed, and we touched on that earlier in this communication, that the length of time for the test results to come back is coming down steadily. It was 2 to 3 weeks, then 1 to 2 weeks, and now it's less than a week. And these are reliable tests. The number of folks who come back to the department is in the low single digits, and I can't emphasize the importance of that enough. And the staff are very skilled and used to taking care of this now, because they have some experience doing the screenings, providing the care, and giving an appropriate disposition.
That's great. Thank you. And Dr. Bickle, did you want to quickly add anything to that? It was a pretty comprehensive response.
Just amplify a little the evidence behind the 6-foot rule, because this person seemed pretty skeptical. There's actually three sources of information on this. One is physics studies he referred to, looking at droplets and how they transmit and tracking them with various laser devices and things like that. It's true, certain activities like sneezing can propel it farther, singing, but for the most part, the 6-foot rule holds. There's also studies that have looked at small groups of people, very carefully tracked for transmission, who got it, who didn't get it, and they found that the rule held pretty strongly, except there is this qualifier that when you're in the path of an airflow through a ventilation system, that can change things, but that's not typically what happens. And then there are studies that have been done, actually sort of population studies looking at this, and it actually found that most of the effect was at 3 feet, and that the 6-foot was actually just kind of a safety factor. They looked at three things that mattered a lot. They all had similar proportions of reductions they achieved. One was eye shields, actually. One was face masks, and one was the 6-foot rule, which they actually simplified to a 3-foot rule if it was 3 to 6 feet. And all of them had substantial reductions in transmission that were statistically significant in multiple localities. So there's evidence from several directions. This is a kind of a tricky area to sort out completely. You can't just, it's not like a drug you can just do a study on with people taking a pill. But there's pretty good evidence from several different directions that the 6-foot rule holds.
That's great. Thank you so much. Again, very helpful information. I'm going to ask a question, pose this to both, I would say, Jonathan and to Matt. It has to do with short-term vacation rentals in our community. I know that the county submitted a plan that was approved by the Business Bureau, and I know that's a very active plan, and so if you can touch on this topic, is there anything that can be done to protect single-family residential homeowners from vacation rentals next door in light of COVID? They suggest they have had wild parties, parking in the cul-de-sac, other issues that have come about, and it's within a few feet of their house. And so, Jonathan, can you touch briefly on the short-term rental plan that was submitted, again, from the county? I know we do have a lot of vacation rentals in our community, both in unincorporated and incorporated Flagler County. And then, Matt, some information for the resident would be helpful.
Sure. Thank you, Mayor. So at the end of the day, vacation rentals are actually regulated by the state, but the county also has, and local governments in general, can also have some additional regulations, but not many. And the more regulations we put in, the greater chance the state would take that authority away, and have been trying to do that for a few years now. But one of the deals that the State Department of Business Professional Regulation, it's a mouthful, who officially oversees vacation rentals, said that if counties submitted a safety plan, and that safety plan, and it would apply to every municipality within the county, that safety plan would encompass requirements on the vacation rental companies and or vacation rental property owners that talked about cleanliness. So the intent was protecting the vacation rental clients and staff that may be cleaning it. And it really is more about the cleanliness to do with clients inside the facility. And initially it also covered to ensure that people traveling from New York, New Jersey, Connecticut, and for a period of time, even Louisiana, were appropriately reporting per the state resolution. That is no longer a thing. The state of Florida lifted those requirements from those states to report and quarantine for 14 days, which I believe was the right thing to do, because in all honesty, Florida is in a worse situation than those states are at this point in time. So it'd be kind of hypocritical to keep that in place and to single out those particular states. So that part is gone, but the cleanliness requirements, the messaging that must be inside of those facilities, that is still in place. That information is on the Visit Flagler website. That's our tourism website at visitflagler.com, which covers, again, all of our municipalities and the counties. That plan was approved and updated and approved by the state. If there are concerns about it not being appropriately enforced, then there is a link to a complaint portal that is managed by the Florida Department of Business and Professional Regulation, where residents can file a complaint. There's also an 800 number, but I'll be honest, their complaint portal's easier just to type it in the box anyway, where you can do that and where DBPR will investigate and take potential enforcement action. I'll be honest, I have not heard of any enforcement actions done on the state on vacation rentals. It doesn't mean it's not happening. I think the state takes a stance of educate the vacation rental entity first before action, which is not a bad thing to do. It's, hey, don't forget, in your community, these are the rules that we approve and you have to abide by them. However, I also do know that DBPR is getting stricter when it comes to restaurants and bars. As recently as a day or two, within the last 48 hours, they yanked liquor licenses from 4 bars in Orlando. So they're getting much more for not following the shutdown rules and the social distancing, primarily the social distancing rules in the bar, what was cited. And again, those are bars that are operating as restaurants, even though, because bars are supposed to be closed. But so DBPR is getting more aggressive with those enforcements. Again, they can't have investigators out watching everything. So they do rely on complaints filed so they can investigate that stuff. But for those that live in, but to that actual question about living in that neighborhood, it's all about social distancing again. Just because, let's say that house, that vacation rental house property was full of COVID-19 positive people, hypothetically. As long as you, the neighbor, social distance from them and stayed that 6 feet away and wore a face mask while you were out and about, hopefully those renters did as well. But again, you can't control what another individual does. You're doing the best thing to protect yourself by avoiding close contact with those. When it comes to partying and things like that, I'll have to let Matt talk. That's more of a code enforcement issue than a COVID issue. But on the COVID side of things, you're going to see that whether you're in a store where people aren't doing the right thing. I think everyone just needs to take some onus on themselves too and just protect yourself. If someone walks up to you and gets closer than 6 feet, then step back those 6 feet. You know, I noticed, and this is just a little thing that I did. 2 weekends ago, I actually went with my family and we went and did a couple days at Disney World. And you know, I did a ton of research on it first to make sure it would be safe. And the fact that nobody's at Disney right now and they are doing social distancing, I even witnessed it myself, that how active they are with it and taking their own personal responsibility for their visitors. Is if someone approaches as they call them, cast members there, or a person in a store, you'll actually actively see them stepping back to maintain that 6 foot social distancing. I was highly impressed by that. I think our residents and our business can do the same thing. If someone is not wearing a mask and is approaching you, or even with a mask and you want to have a mask on and 6 feet, which is utopia, take that step back. So that same scenario applies to these people. If you have neighbors or vacation rental folks that are infringing upon your personal space, then back up. Obviously, if they're on your property trespassing, that's a law enforcement issue, but protecting yourself from COVID-19, if they're getting close to you, back away, make sure the mask is on and keep backing away and lock yourself back up in your house if you have to. And so that's kind of my way of answering that is protect yourself. You're responsible for yourself. If there's law enforcement or code issues, I know Matt will talk about that, but it's your responsibility to take care of yourself and don't get yourself in that situation and back away if you have to.
Yep, I completely agree. Thank you so much. Matt, very briefly, because then we're going to have
Make
to
this very brief. So
close down a little bit.
we want to help you. If you have these concerns and you're having issues that are unresolved, please go to palmcoastconnect.com, create a case. That is the best way for us to not only receive your issue, but help you get resolution to your issue. Again, palmcoastconnect.com. And also you'll get emails throughout the process to know where it is. By the way, very briefly, what Jonathan said, also the Department of Business Professional Regulation, if you'd like. Their phone number, 850-487-1395, or their online portal that Jonathan mentioned is simply worldwideweb.myfloridalicense.com. So that's the information for DBPR, but again, please feel free to go right to Palm Coast Connect. You'll be able to create a case right online in a few seconds, and we'll be able to assist you with genuine concerns through code, noise, and help you resolve your issue, hopefully.
Yeah, unfortunately, we are out of time. Normally, we ask for closing comments. I would just really close it out by saying the questions that we've not been able to get to due to time constraints today, we will be responding to those questions and posting them as well. Again, next week will be our next town hall meeting. 2 weeks from now, I know we have confirmed the superintendent of schools to be here to answer a lot of questions around schools after the reopening. We thought that was a really helpful moment for our community to understand. But there were a couple questions about schools, so I'm going to ask our panelists to review some of the questions, and any responses they could provide would be really helpful, and we will post them for our residents to have their questions answered. So please continue to tune in to our town hall meetings. Please make sure you're wearing your masks. We do have a mask mandate and a mask campaign going on right now. So hashtag, Tyler, I wish he was sitting right here. I think it's
Mask Up Palm Coast.
Yes, Mask Up Palm Coast. Hashtag Mask Up Palm Coast. Take a selfie with your mask. Let's get the community excited about wearing masks and demonstrating how we understand how important it is to each and every one of us.
And you can pick up masks at all of the fire stations in Palm Coast.
So that's another great way to, when you're out and about in the community, visit one of our fire stations and pick up a mask, so no one will have any excuse not to be wearing one. Thank you so much again to our residents. You have truly been extraordinary partners throughout this entire time period. It has helped tremendously. Please keep it up. Thank you so much to our partners that continue to join us and really be the responders to COVID. We couldn't do this without each and every one of you. So everyone have a great week, stay safe, and thanks again.